Okay, folks, we're going to go ahead and get started. Welcome to COVID-19. Good afternoon, everybody. Thanks for joining us. This webinar is brought to you by the Seago Area Agency on Aging, State Health Insurance Assistance Program, and Senior Medicare Patrol. I'm Ramona MacMurtrie, the SHIP SMP Program Coordinator, and you're about to find out that I'm a little bit of a nerd when it comes to online scams and attacks. As the world battles the new coronavirus, COVID-19, and attempts to survive, scam artists, internet phishers, and fraudsters are taking advantage of the situation by trying to scam you out of money and personal possessions. Don't let them. Protect yourself, do your research, and be aware of the type of schemes going around. Don't click on that link that claims to provide the latest information on the virus. Don't give up your personal information in order to receive money or other benefits. Between March 1st and March 23rd, Barracuda Sentinel, a worldwide leader in security and data protection solutions, detected 467,825 email attacks, and 9,116 of those were related to COVID-19. In February, only 1,188 coronavirus-related attacks were detected, and just 137 were detected in January. Unfortunately, scammers show no signs of cooling it with their coronavirus-themed scams. All of us need to stay on top of these scams, and we need to share the information with friends, family, and neighbors. The FBI has seen a rise in fraud schemes related to the coronavirus pandemic. A variety of campaigns are taking advantage of this heightened focus to distribute malware, steal credentials, and scam users out of money. Barracuda researchers have seen three main types of attacks using coronavirus or COVID-19 themes: scamming, brand impersonation, and business email compromises. Of the coronavirus-related attacks detected by Barracuda Sentinel through March 23rd, 54% were scams, 34% were brand impersonation attacks, 11% were blackmail. Skilled attackers are good at leveraging emotions to elicit responses to their attempts. They rely on embarrassment and fear to scam people out of money. With the fear, uncertainty, and even sympathy stemming from the coronavirus COVID-19 situation, attackers have found some key emotions to leverage. For example, and this one was really horrifying to me, one blackmail attack claimed to have access to personal information about the victim, know their whereabouts, and threatened to infect the victim and their family unless a ransom was paid. Barracuda Sentinel detected that particular attack occurred over 1,000 times over the span of 2 days. Some of the more common scams are the free passes to Netflix. It's a really popular one right now. It's not as vicious as the coronavirus blackmail scheme, but it can still cause serious damage. As you can see, this link does not lead users to the legitimate Netflix domain, netflix.com. Instead, it points to a lookalike site hosted at netflixusa.net. The site asks you to answer some questions about how you're handling the global pandemic. It then asks you to share this site with 10 of your friends. Bitdefender, which is a global cybersecurity software company, has figured out that the site did this for the purpose of tricking even more individuals into sharing their personal information with the attackers. I don't know how many of you have seen this, the promise of a COVID-19 safety mask. This app demands the right to read your contacts and send SMS messages as soon as you click on it when you download. Once it's finished loading onto your laptop, your phone, your tablet, or your other devices, it starts sending SMS text messages. It uses standard communication protocols to let mobile devices exchange these short text messages. So the link asks you to click on a button that redirects you to a portal where they can enter your information so you can get a mask. Nothing happens once you click the button, but the app does collect all of your contacts, and it does start sending out text messages that spread this scam even further. This one just started up. Go to 2020census.gov and fill out this census form so you can get your stimulus check. This message on Facebook Messenger tells Mr. Wilson here that he's not going to receive his COVID-19 stimulus check unless he completes his census form. There's a huge problem with this. The census has nothing to do with the stimulus plan. It looks like malicious attackers are using compromised Facebook accounts to try to trick people into providing their personal and/or financial information. I got this one on my cell phone just last week. A text demanding that I take a mandatory online COVID-19 test. The Better Business Bureau states they've received numerous reports of individuals posing as employees of the U.S. Department of Health and Human Services or another U.S. government department. Using text messages, they're instructing recipients to click on a link for the purpose of completing a mandatory online COVID-19 test. Here's the problem. There's no way of testing someone for COVID-19 online. The link directs you to a fake web portal which steals your personal, your financial, and your medical information. This one is an email. It was sent to me from a friend who's a ship coordinator in Illinois. The email warns you, and this one's really scary. It warns you that you come into contact with a colleague or a friend or a family member who has COVID-19. The email then instructs you to download and print an Excel spreadsheet so you can bring it with you to the nearest coronavirus testing site. Here's the problem. When you click on there, the Excel spreadsheet is called emergencycontact.xlsm. It has no information pre-filled in the like the email said it would. So the document informs you you need to enable the content in order to view the spreadsheet's details. When you comply, you activate the document's malicious macros and you allow this code to infect your computer, your tablet, or your phone with a Trojan downloader. For those of you who don't know, a Trojan is a harmful program that drops other malware files onto your computer, which is now compromised. This one is from the U.S. Small Business Association. This email looks like official correspondence from the U.S. Small Business Association, and it's been making the rounds lately. They claim to provide you with an application number so you can apply for a small business disaster assistance grant. Just sign an attached document that's supposed to authorize a request for a tax return transcript, and you upload it to the Small Business Association's website. The application process in the email follows the same sequence that's actually employed by the Small Business Association. It's a really hard scam to spot because it looks so authentic, and it plays on the heartbreaking need for small businesses right now that need all the help they can get. Instead of helping, this email downloads a sample of the Remcos remote access Trojan family. Remcos is a remote access Trojan that can be used to fully control and monitor any Windows computer, starting with Windows XP and going on up to Windows 10. So basically what you're doing when you click on this is you allow them access to your computer or your tablet or your phone or wherever you're accessing the application from. The next one, this caught me completely off guard. I did not believe that somebody could do this, but apparently they are. Fraudsters are creating pop-up testing sites for COVID-19. This one appeared at the corner of 17th and Broadway in Louisville, Kentucky. According to the reporter, these fraudsters were dressed in personal protective equipment, and they were telling passersby that they could test whether they were infected with COVID-19 for a lovely little fee of $240. They used the same gloves to examine all their patients. At best, they gave no healthcare service at all. They made off with their victims' money, and they stole their personal information in order to make fraudulent Medicare and Medicaid claims. At worst, They possibly expose their victims to the coronavirus by not disposing of their medical gear in between examinations of their patients. Like I said, this one particularly horrified me. I didn't believe that anybody would have the nerve to go ahead and set up a fake testing site for coronavirus. There's hundreds of scams looking to sell coronavirus cures or face masks or asking for investments in fake companies that claim to be developing a vaccine. There's scams in the form of donation requests for fake charities. One such scam that was caught again by the Barracuda systems claims to be from the World Health Community. The World Health Community doesn't exist, but it sure sounds an awful lot like the World Health Organization. And they ask for donations to a Bitcoin wallet provided in the email. Now, some of you, I don't know if you know, a Bitcoin wallet holds Bitcoin, and Bitcoin is digital currency. It doesn't go through any central authority like a bank or a payment gateway. It's internet web money. So this scam is pretty popular. Another one that I've been seeing a lot of, and I almost got caught up in it myself because I didn't check when I went to a login page and I clicked on the first one. Is this what your Outlook login page really looks like? Is this your real login page? There's a lot of email login pages, a lot of sites that you normally use to log into somewhere. I was 2 weeks ago, I was getting ready to go to the United States Postal Service login so I could do a change of address. I clicked on the wrong one, just the first one. I was in a hurry. I clicked on the wrong one, and all of a sudden I get a notification from my bank saying that there's a $49.95 charge against my card, and did I authorize that? Well, I go to look back on it, and sure enough, I had logged into the wrong postal site. It looked exactly like USPS, where you go to do an official change of address. Excuse me. Turns out it was the wrong one. So it can happen to anybody. You have to be really careful where you're logging in. Make sure that you're not clicking on the first thing that Google pops up to you, and make sure that you are on the correct site. So how do you protect yourselves from these things? I mean, it even happened to me. Be careful. Be wary of any emails that are trying to get you to open an attachment or click on a link. Anti-malware software can be especially helpful to prevent malicious emails. But even with those protections in place, you should always be careful because there's no program out there that's going to protect you against everything. Watch out for any communications claiming to be from sources that you normally don't receive emails from. If you don't normally receive emails from the World Health Organization and you start getting them, pay close attention and make sure that it is the correct address. The CDC isn't going to be sending out emails to anyone who doesn't regularly receive emails from them already. Use caution with emails from organizations you regularly communicate with. Brand impersonation is very common in coronavirus-related email attacks, so be careful opening emails from organizations you expect to hear from. Make sure that the address is correct. Pay attention to the sender line. Healthcare industry, all of the organizations in the healthcare industry are being targeted by cyber attacks because they're all trying to get information, medical information, financial information. Charities are particularly vulnerable right now. A common tactic for coronavirus-related scams is asking for donations to help those affected by the pandemic. Be careful. Don't respond to email requests for donations. Find credible charities that are helping with coronavirus efforts and donate directly through them. to help ensure that your funds are going to end up where they can do good rather than in the hands of a scammer. It's also highly unlikely that any legitimate charities are taking donations through Bitcoin, through gift cards. Make sure that if you see anything like that, it sends up a red flag and you're being careful and you're protecting yourself. Basically, don't provide your username, your password, your date of birth, your social security number, financial data, or any other personal information in response to an email or a robocall. Remember, your bank already has your bank account number. Social Security, Medicare are not going to email you and ask you for your Medicare number or your Social Security number. Don't respond to calls or texts from unknown numbers or any others that appear suspicious. Never, ever, ever share your personal or financial information via email, text message, or over the phone if you're not sure. If you didn't initiate that call or initiate that text, don't share your information. Be very careful if you're being pressured to share any information or to make a payment immediately. Scammers often spoof phone numbers to trick you into answering. Remember, government agencies are never going to call you to ask for personal information or money. You're not going to get arrested for not going to jury duty if you don't pay $500 with an iTunes card. It's not going to happen. For more information about scam calls and texts, visit the FCC Consumer Help Center, and you can also file a complaint about these scams at fcc.gov/complaints. We're going to spend a little bit of time looking at Medicare scams. Scammers are trying to bill Medicare for fake tests or treatments related to the coronavirus and are targeting individuals to illegally obtain money, Medicare numbers, or personal health information. Medicare has gone through some processes in the last couple of weeks, and they have relaxed a lot of rules, and scammers are taking advantage of it. What can you do to stop this kind of fraud? Don't give out your Medicare number to anyone other than your doctor, your healthcare provider, or other trusted representative. Protect your Medicare number. Treat it like a credit card. Never provide your Medicare number to anyone who contacts you through unsolicited calls, texts, or emails. Be really cautious of anyone who comes to your door offering free coronavirus testing, treatment, or supplies. Don't click on links from sources you don't know, which could put your computer, your tablet, or your phone at risk. Make sure you have anti-malware and antivirus software and that it's up to date. Ignore online vaccination offers. If you see ads for prevention products or cures for COVID-19, they're a scam. Likewise, be cautious when purchasing medical supplies from unverified sources, including online ads and email or phone solicitations. Be careful making donations. Do your homework. Be particularly careful of any charities that are requesting donation by cash, gift card, or wire transfers. Here's one that I hadn't thought of, but I was reading up on it. Be careful to investment opportunities. Be alert. U.S. Securities and Exchange Commission is warning people about online promotions claiming that their product or service can prevent, detect, or cure COVID-19, and that their particular company's stock will dramatically increase in value as a result of how marvelous their product is. That's one that I hadn't expected, but sure enough, it's out there. Medicare is covering COVID-19, and I've gotten quite a few questions. Medicare Part B is covering COVID-19 tests when they're ordered by your doctor or your healthcare provider on or after February 4th, 2020. So what this means is if Medicare didn't cover it at the time and you got billed, you can request that healthcare provider re-bill and resubmit a claim to Medicare if the treatment was done after February 4th. Medicare is covering all medically necessary hospitalizations, including extra days in the hospital for patients who had to stay longer under COVID-19 quarantine. Right now, there is no vaccine for COVID-19, but when, I hate to say if, I want to say when one becomes available, Medicare will be covering it the same way it covers a pneumonia vaccine, the same way it covers your flu vaccine. Medicare recently expanded coverage of telehealth services to enable Medicare beneficiaries to access a wider range of services from their providers without having to travel to a clinic or a doctor's office. This includes access to doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. I know I breezed through all this stuff. Does anybody have any questions? Anybody? Somebody? A question? No questions. Okay. We're still here to help you. There is somebody manning our phones Monday through Friday from 8 to 5. Our number is 520-432-2528. You can visit our website. You can follow us on Facebook for updates from reliable sources. We're very, very careful of what information we do post on Facebook. We have webinars coming up. Karen Enriquez, our Family Caregiver Support Program Coordinator, is doing another episode of Who Cares? We Do at 9 o'clock on April 15th. And I'll be back next Friday, April 17th at 3 o'clock to talk about Medicare enrollment periods, which should be of particular interest to those of you who have a change in status or who are coming up as new to Medicare. Again, thank you for joining us. We appreciate you. Stay tuned to events on our Facebook page. As I said, we're trying to keep those updated. We're trying to present at least 2 weekly webinars on caregiving, Medicare, and other timely topics. Again, thank you for joining us. Everybody stay home and stay healthy.